Hello. Today, I would love to cover hernias and discs, and I actually want to throw prolapse into that as well. So, most people think that hernias and disc issues and prolapse are freak accidents, something that just pops or slips. But what if I told you both are actually pressure management problems? So, today, I want to break down why your body fails under pressure and how to stop it from happening. This is the stuff that blew my mind, and I didn't understand why it wasn't explained and shared so easily like this. So I want to try and do my best to explain it so that you can feel comfortable moving everyday life. So if you're someone with a disc issue, hernia, prolapse, then carry on listening. So both hernias and disc issues share one core pattern: a weakened tissue and a poorly managed pressure, which means injury. And often we look at the weakened tissue, but we don't think about the pressure management side of things. And I'm going to explain exactly what that is in a second. Yeah. So let's talk about hernias for a second. What's actually happening is something inside your abdomen pushes through a weak spot in the abdominal wall. And two reasons for this could be a tissue weakness, so it could be genetics, it could be aging, surgery, pregnancy. And number two is a pressure spike, so lifting poorly or coughing or straining in some way. So the key message here I want you to leave with is a hernia is not just pressure, it's a weak tissue that can't handle pressure. And now disc issues is your spinal discs have an outer ring and a gel-like center. So over time, that outer ring can weaken from, again, genetics. It can weaken from sitting, can have micro tears, dehydration even. Have you ever been that person where you just like, all I did was just bend over and my disc popped out, or I felt it in my back? So it could be just down to the fact that you haven't drank enough for your body. And then a pressure spike or a repeated load. So if you are lifting with bad form, if you feel it a squat, for example, in your back constantly, please change your technique. Or twisting under load. You know how I explained where you could be grabbing something, twisting, or you're doing the poor form sort of thing. It pushes the disc material out. So again, weak tissue or pressure or load that exceeds capacity. Just like a hernia, the disc fails where it's already vulnerable. Again, prolapse. A prolapse could be, for example, I know someone who gave birth fine and then decided to lift a heavy cupboard, very newly postpartum, and it caused prolapse symptoms. So she was frustrated in the fact that she didn't actually get a prolapse from the birth. She got a prolapse from lifting poorly and not managing pressure. She could have already had underlying tissue, weak tissue from giving birth, and then adding in the lifting, which is why you need to look after yourself and be so careful postpartum, caused a prolapse symptoms. So let's go into, before we go, let's talk about pressure management, that missing skill and it seems to be missing skill because everywhere I look, it's poor pressure management. And I didn't know this, and I'm a personal trainer, and I only learned this since having children, since studying, and since learning about pre and postpartum rehab and how to get strong again, like even stronger than before having babies. So this is where people get confused. So pressure itself isn't always bad. Pressure is actually protective when managed well. For example, imagine you were lying down and your child decided to jump on your stomach. Well, that is a lot of pressure when you are not aware. And for me, it'll probably go right down into my pelvic floor because there's a weaker tissue there. If you are managing pressure well, if you knew the child was about to jump on you, you could put a bracing strategy in place, add pressure in a controlled way, and then you wouldn't have that horrendous impact on your stomach because you have braced in the right way. And we're going to go into this in a bit. So you've put in that protective barrier. Pressure stabilizes the core. It protects the spine. It helps transfer force. Pressure when you are pregnant is handled well. Your baby helps create pressure in you. And then once you have had baby, you've got the loose skin and you can't handle pressure well in your core canister anymore, which is why you need to rehab and retrain and understand how to breathe back to your normal breathing pattern, which is where we're going to go into that core canister and why this is the basis for everything. Pressure management and understanding the core. So the problem arises when pressure is uncontrolled, sudden, repetitive, combined with poor mechanics and placed on weak or fatigued tissue. So if you've been in the gym and you've pushed yourself, saw it yesterday, you go into your 1 rep max in a squat and you just wanted to do that last one. You've got everyone in the gym egging you on, pushing you, getting excited. Yeah, you can do it. Just do one more. It'd be great. Do your 1 rep mats. The trainer's there helping support you in the barbell. And then you can't lift it. You're fatigued. You then end up injuring your shoulder. And this actually happened yesterday in one of my sessions. So frustrating for this girl. So let's talk about the core canister. Can, like I don't know, a Coke can, you know, the cans. The top part is your pelvic floor. The top part is your diaphragm. Your bottom part is your pelvic floor. The side is your back, your spine, and the other side is your core. So your transverse abdominals, your obliques, everything that keeps strong in the front of your stomach. Now, as you breathe in, your diaphragm lowers, which means your pelvic floor naturally lowers, which is pressure, which is a normal pressure. As you breathe out, your diaphragm lifts and your pelvic floor lifts. It's a nice, working, functioning body. You can breathe into your back moves nicely, your core stabilizes you. And everything's working well. The issue is, like we were explaining before, for example, if we're doing things with poor form or we can't manage pressure well, if we've got a weak core from having children, or we're not breathing well, we've been taught to belly breathe. So what good pressure management looks like. So I'm going to go through some examples. Breathing and bracing, using the diaphragm and the abdominal wall to create controlled intra-abdominal pressure. Like I was saying with the child jumping on your stomach, most people I talk to cannot brace, which is why I don't like weight belts on people, because when they whack on a weight belt, pressure has to go somewhere. And because we can't understand how to load well in that core canister, pressure could come down into the pelvic floor, causing prolapse symptoms, or it could come out into a disc issue or a hernia. Managing that pressure better. If you are bracing correctly, you can handle a lot of load before then you need to consider adding a weight belt on. And then even if you do, you need to make sure you can brace well before adding a weight belt on. And I actually go into a video on how to brace in here, so I will share the link. Next one is having a neutral spine under load. So flexion and load is the highest disc stress. So flexion, where I'm talking about that big arch in the lower back when you're dropping down into a squat. Who feels their lower back when they are doing a squat? Could be an issue with your positioning, your technique, or not actually being able to activate your lower transverse abdominis well, or breathing effectively in that core canister. If you have that neutral spine and you can brace well, this is your strongest position. Next one, number 3, I've actually got 5 of these, a hip hinge instead of a back bend. So I said go into that flexion to load up the lower back. Lift with your hips, glutes and legs, not your spine. Here's a great one for doing a deadlift, for example. If you can't hinge well, then you are going to load up that lower back. And just because everyone else is around you is like, you can do it, lift, you've got that lift. It doesn't mean you are lifting well, and you're not going to come out of this in a worse state. If you are feeling it in your lower back when you do a deadlift, when you squat, we need to tweak it. We need to focus on a hip hinge, see if you can actually do that. Most people cannot hinge well. They kind of fold over rather than leaning in, like gliding back. Again, there is a video to watch on how to hip hinge and how to train your body. Once you've got it, you've got it. You feel it in your core, your lower abs, you feel it in your glutes, and you don't feel it in your lower back. Number 4, avoid straining behaviors. So chronic coughing, constipation, poor lifting strategy all contribute, especially to prolapse. Number 5, build tissue resilience. So strong, conditioned tissue tolerates pressure far better. So hydration, protein, eating well, nourishing your tissues, like doing release work so you're not super, super tight and your fascia is just like, oh my goodness, I'm so dehydrated. Doing release work will help because then you are not using other muscle groups to shift you out of a better positioning because you are tight in other areas. Okay. So the core message I want to leave you here with is hernias and disc issues aren't just random. They happen with a vulnerable tissue meets unmanaged pressure. And this is empowering. I hope you leave this thinking, oh my goodness, okay, I know now why I've got these issues or how I want to prevent these issues from occurring because I'm feeling it in my lower back. You can improve pressure. Watch the videos. There's some really amazingly simple things you can do to retrain, and you just need to retrain your body consistently, and then eventually things start shifting and you're like, cool, oh my goodness, I'm lifting heavier, I'm not feeling my lower back. You can improve pressure management, you can improve tissue capacity, and you can reduce risk dramatically. You are not fragile, you just need skills. So if you want to learn how to lift, to breathe, and to move in ways that protect your spine and your core, then just tune in, carry on listening, like watch the videos that I share in the show notes in the links below. And I hope you've enjoyed this. If this, whatever I've provided for you, I never know how to end videos or end discussions. So farewell, that's it from me for now.